I'm Timothy Donahue. I am a professor in the Department of Surgery and the chief of the Division of Surgical Oncology at University of California, Los Angeles. So the question relates to who should get a second opinion newly diagnosed with pancreatic cancer, and where should they get that opinion? I think a second opinion is good. I think that the process that patients need to go through is, to decide and determine whether or not they're comfortable and confident with the treatment team that they've met to, where they're being treated. That being said, I think that that's the most important aspect. But the management of pancreatic cancer has become so complex, so much more complex and nuanced. Both the surgical treatment and the medical or radiation treatment. It's important that patients who are not necessarily seen at a high volume, multidisciplinary, tertiary quaternary academic medical facility, at least think about being seen at one of those programs, just because I think that the opportunities and resources at these programs are much more geared towards treating patients with what is this complex disease. Just the surgery in and of itself, there's been study after study that has shown that, the outcomes are best done by surgeons who do a lot of them at hospitals where a lot of them are done. It's not just for the surgeon or the surgery itself, but it's management of the potential complications and the other services that are involved and have experience with them, like radiology or interventional radiology. That's data that even came out, I would say, 10 to 20 years ago. But just, being an active participant in the field during that time, I can tell you that, the surgeries that we're doing and the decisions that we're making now are so much more complex than they were, even 5 years ago, in terms of vascular resections and reconstructions, and just thinking about patients on a case-by-case basis, like potential resections of patients who have oligometastatic or small volume metastatic disease, select patients who have undergone the right treatment. And so that's why I think it's so important for these patients to at least have an opinion from a well-coordinated, highly experienced group that gets together and meets and discusses them in a multidisciplinary tumor board or uses that approach. In terms of the medical treatment of these patients, the medical oncology aspect, that's become even so much more complex too. Thinking back 20 years ago when there was one chemotherapeutic option, now there are so many more cytotoxic chemotherapeutic options. We're doing more and more personalized care for patients. There's so many promising, what I would say, state-of-the-art phase 2 or even phase 3 clinical trials that are ongoing for patients with various stages of pancreatic cancer. And I'm biased. I practice at a high volume specialty center where we see a lot of patients, and I am very confident that I can tell all my patients that they're receiving state-of-the-art care for their disease. I think in summary, it's important for patients to be comfortable with their treatment team, to trust their surgeon, their medical oncologist, their radiation oncologist. That's the number one priority. But the treatment of this disease has become more complex for really good reasons, and it's because options are there. And there's no question that the higher volume specialty centers can provide patients with more options, potentially unique thinking and approaches to their disease, which may very well lead to better outcomes. And so, that's something to consider when, when deciding where you're going to get treated, how you're going to get treated, and how you're going to go about doing all this.